Address confidential. Whoops, there we go. Pardon me. To share the Maryland Safe at Home Address Confidentiality Program as a resource with this regional conference gathered in recognition of Human Trafficking Awareness Month. My name is Danielle Troiano. I'm the program's community liaison. As of 2023, an increasing majority, 41 states and the District of Columbia, offer address confidentiality programs. The common goal of the program is to shield a survivor's actual address from public records to reduce the risk of further harm. As the programs are legislated and enacted, program eligibility and areas of coverage can vary. Legislated in 2006, Maryland became the 20th state with an address confidentiality program, which is administered by the Office of the Secretary of State. Since 2006, legislative additions include the expansion of program eligibility to victims of human trafficking in 2014, passage of House Bill 633, Senate Bill 578, the shielding of real property records, which allowed ACP participants to safely purchase property, as well as requiring all private entities to accept the substitute address of an ACP participant. In 2019, the shielding of real property records for victims of domestic violence law went into effect. In 2021 legislative session, Senate Bill 109 was introduced, passed, and went into effect, allowing people who are threatened and fear for their safety, such as judges, police officers, prosecutors, women's health care providers, and individuals generally, to participate in the ACP and be granted address confidentiality, even if they're not survivors of intimate partner violence or human trafficking. To date, the program's authorizing statutes are State Government Article Section 7301 to 73120, with deed shielding found in real property articles 3114 and 3120, governed by the Code of Maryland Regulations, Title I, Subtitle 2, Chapter 11. The ACP now serves victims of threatened, attempted, and actual domestic violence, sexual assault, stalking, harassment, human trafficking, and individuals under increased potential threat. Program participants are authorized to use a substitute address in place of their actual address to keep their actual address off public record. State and local government agencies and private entities must accept and use a program participant's legal substitute address, keeping their information off public record so that their perpetrator cannot find them. In special circumstances where the actual address must be known, such as utilities, we provide program participants with instructions and assistance and guidance to keep their addresses safe. We provide program participants a legal substitute address for home, work, and school, a fee-free mail forwarding service for first-class mail, no packages or magazines, a unique ACP authorization card, which you see on the screen there, as well as a notice of ACP participation letter in long format, a welcome packet, including a handbook to navigate as an ACP participant, and welcome call. We provide assistance with acceptance of ACP notification issues, program verification letters on behalf of a program participant at their request. By itself, the ACP cannot keep a person safe, but combined with other safety strategies, the ACP can help a victim start a new life. With the substitute address, participants can obtain a Maryland state ID or driver's license, sign a lease agreement, register to vote, purchase real property, enroll in school, access social services, participate in court proceedings, interact with law enforcement, fire and EMS, maintain a confidential residential, work, or school address, all without disclosing their actual address. How do individuals join the ACP? Individuals may learn about the program from community partners, law enforcement officers, victim service organizations, social services, or by direct program inquiry. The program isn't offered in the crisis intervention stage, but instead when the individual is away from the violent incident. Individuals are referred to trained and certified application assistants who provide safety planning, complete the participant application with the individual, then send the application to our office and any other additional services and support their organization may provide. The ACP is only part of an individual's safety plan. The individuals are referred to application assistants who are our community partners for the assistance in the areas of their need. Here are our program stats as of yesterday. Normally, an average of 12 join the program each week. Last week, 20 joined the program. The largest 4 categories of victimization that we see on applications are domestic and intimate partner violence, stalking, and harassment. Of the program participants who indicated human trafficking on their applications, 9 indicated sex trafficking, 4 indicated labor trafficking, 1 didn't identify type. It isn't necessary that a victim indicate the type of victimization in these applications, so there may be more than what we see in those numbers. You can also see that with deed shielding, since deed shielding went into effect, we currently have 69 shielded deeds. Also very small on the screen is the number of primary program participants and then other program participants. We have 40% as primary program participants who sought out help with an application assistant, but their children and household equals 60% of our program participants. In each county, we have a wealth of community partners, including victim services, law enforcement, social services, faith-based groups, counselors, and more who share the ACP with the people they serve. Listening yesterday, I heard quite a few of our community partners also involved in this conference. We provide new and existing community partners with application assistant training, new and refresher, to share, pre-qualify, and complete a participant application with clients they are serving. Referrals from individuals searching for victim service organizations within their communities, timely support, and other program training specific to the organization upon their request. As we all know, in victim services, as well as many other fields, there can be attrition, as well as new staff additions. We always appreciate connecting with our community partners and assisting their application assistants with any questions they may have. Who can become an application assistant? An application assistant is an employee or volunteer of a federal, state, or local agency, or of a non-governmental program that provides counseling, referral, shelter, or other services to survivors of domestic violence, sexual assault, stalking, or human trafficking who has been designated by the respective agency or program to receive training. The application assistant verifies that the individual is a victim of threatened, attempted, actual domestic violence, sexual assault, stalking, harassment, or human trafficking. They are a Maryland resident. Immigration status is not considered. They have recently moved to a new location unknown to the perpetrator. A shelter or a friend's house is acceptable. The new address is not public, not on their driver's license. They haven't submitted a change of address to the United States Postal Service or Motor Vehicle Association, and they are not currently a homeowner. All of those areas would mean that their new address was on public record. That's why it's important that their address has not been shared with those entities, the new address. We're unable to redact what is already on public record. You might recall from earlier the addition of individuals with increased security or privacy concerns, such as judges, attorneys, law enforcement, anyone who may have an increased potential risk of harm. Our office completes the application with those individuals. We welcome new and existing community partners to connect periodically for new and refresher application assistant training because of legislative updates and literature updates. I'll pause here for you to make a request for program brochures and to request ACP training for your team and answer questions while you make your request for brochures or training, and then advance to the contact slide as our last slide after questions. I'm also going to drop the links in the chat should you not have your smartphone handy to then be able to access those resources. I'll take a moment to drop that in the chat, field a couple questions as folks are looking at those slides if they wish to use the QR codes, and then we'll move to our last slide in a few moments after questions. I'm also going to provide in the chat a outreach flyer if anybody would like to view that as well, a fact sheet. There we go. Doesn't seem as though we have questions at the moment, and we can also open to questions at the end. So we'll go ahead to the last slide. And Caitlin, I'll signal you in a moment, but to everybody, I want to thank you for allowing me to share the ACP as a valuable resource, helping survivors advance forward while being safe at home. Thank you all for the great work you're doing in your communities to create awareness, mitigate, and eradicate human trafficking. For those of you who would appreciate a trigger warning and don't wish to hear a personal share, I will wave at you in a moment so that you'll have the ability to mute your sound. Then after the share, I'll wave again at the screen for you to unmute your sound if you wish. Caitlin, if you would turn off the recording for a moment.
Are you ready? Are you ready for me to start? Okay, great. Once again, I'm Julie Crane, the founder and executive director of Harriet's House. We are a nonprofit anti-human trafficking organization that focuses on fighting against human trafficking and bringing freedom and healing to women survivors. So this issue, a lot of times people hear about the issue and they want to know how they can respond. So how we decided to respond, well, here on the Eastern Shore, we do call it the Eastern Shore over here, and we call you guys the Western Shore. So that is common. So that's a good way to talk about each other. So once we opened up a drop-in center in Cambridge in 2019, and we really wanted to get an idea of what the issue was here in this county. So when we opened up the drop-in center, we decided to serve any woman in the community that wanted to come in to get food, toiletries. We have computer access. We offer life skills classes, and then we have referrals to other organizations. And in that process, we did have some screening questions for human trafficking or exploitation. And it wasn't like we were just going down a list and asking questions. We did it in the form of a conversation, just as we were getting to know the people that were coming in. We've had over 275 touch points with our clients since we opened up, and we have worked with victims of human trafficking and realized that there is a need for housing. So when we were in the process of opening up our drop-in center, when we brought women in, we just wanted to help them with their immediate needs. We had a lot of different community partners who put together things like go bags, which would have toiletry items and lots of things that they could take with them in a pretty little bag. So we did have a lot of participation, and then COVID happened. So while COVID was going on, we continued to reach out to our clients by taking them food to their homes, dropping off boxes at their doors. So we continue to have that relationship even through the difficult times. So what we realized is that there is a need for housing, and human trafficking survivors need a specialized care because of the complex trauma that they endure. There were no housing resources here on the Eastern Shore, and we had to either refer them out of state or to the Western Shore for services. And there were no long-term residential programs in the state of Maryland when we opened up our home. So we became the first home here on the Eastern Shore that helps survivors. So Mary Sanctuary, we named this home after the donor, after his mom. So we had a donor who came and told us in 2021, in the beginning of the year, that he had a house that he wanted to donate. So we had funders that came alongside of us and raised all the funds that we needed to restore this home. It was 112 years old at the time, and we renovated it from top to bottom. So it's like a brand new house. So Mary Sanctuary is located in an undisclosed location in Dorchester County. We are now open with our first resident, and we serve adult women 18 and up. We have the capacity to serve 5 residents. So right now we do have 4 open beds. We have 24/7 staff, and it is an 18-month program. So the highest priority in the home is safety. And as such, we do ask women to surrender their cell phones to be a part of the program, just so that they're not tracked there, or they're not reaching out to someone who may disclose the address. We also have a home's equipped with a privacy fence and a security system with exterior cameras. So there are 4 phases of care. In the first phase, we focus on stabilization, safety, and sobriety. And we help the women to learn life skills. So we teach them how to cook, how to clean, how to do their laundry, how to do chores. So they're learning these basic things right as they get into the home. And then in the second phase, we focus on academics and one-on-one therapy with continued life and relationship skills that are being taught. So we work with each woman to find out where she is academically, and we create her learning path based on her needs. So if she hadn't finished high school, then we can help her get her GED. If she has finished high school and she wants to go on to some other learning, then we help her to get connected with the community college or other programs that will help her to get the skills that she wants to have. And then in the third phase, we focus on job training, resume writing, mock interviews, and help her to attain a job. And then she also is going to continue her academics and life skills. And then the final phase, we're helping her to get ready for leaving the program. So we focus on saving money, making a plan for transition out of the program, and then all the other previous areas that we've been working on. So the criteria for care is that the candidate must be over 18 years old, female, a victim of sex trafficking or sexual exploitation, 30 days sober from drugs and alcohol. She must be ambulatory because we do have a 2-story home, so she would require to go up and down the steps to get to the bedrooms. She must not be a threat to herself or others, and committed to healing and change. So who's beyond our scope of care? Someone who is actively addicted or unwilling to go through rehab, if they're on methadone, Suboxone, or prescribed narcotics. We do not have the capacity at this time to serve women and children, but we do realize that is a great need. As we've opened up our home and we've received referrals, we do see that there are some areas that there is greater need. So we are working towards trying to fill in those gaps. So we've had a lot of calls for people that are in emergency situations and need urgent care, and then also those that have children. We cannot serve those that are escaping warrants or have court obligations requiring out-of-state travel, or someone who is actively suicidal or homicidal or in a mental health crisis. So the referral process for housing is you would go to our website, which is right there, www.harrietshouse.org, fill out the referral form, and then we would have a phone conversation with the referring agency or with the person who's referring themselves. We complete an assessment. We interview the applicant to make sure that we are a right fit for them and that they are a right fit for us. And this process could take up to a week. We try to get through it as quickly as possible, but sometimes there are some delays in the process. So our partnerships that we expect to have for referrals are law enforcement, first responders, hospitals and emergency rooms, state's attorney, district attorney, courts and probation, detention centers, drug and alcohol rehabilitation centers, any mental health agencies, social services. We do expect to be an exit plan for some of those programs. During the last year and a half, we've been doing a lot of community engagement. So going into different organizations and doing presentations and teaching people about human trafficking. So we've spent a lot of our time on education and awareness. So we've been able to go through different counties and train EMS providers and also police departments. So we've been working on getting more relationships across the Eastern Shore to continue that training and education. And then we've also been able to go into schools and to talk with some of the social workers and with some of the students. What we realize is with all of us, we know that education and awareness is key to prevention. So we are trying really diligently to get into some more of the school systems to help teach the kids internet safety and being safe on social media. So with our organization, we do have opportunities for community involvement. So we do accept volunteers. We also have job opportunities. We've realized that this is something that we will always be hiring for. You can donate items, you can donate financially, you can attend our fundraisers and special events. You can follow us on social media, and on our website, you can sign up to receive monthly emails so you can keep in the loop. So this is my contact information, and I'll give you a minute so that you can take that down. And that's my PowerPoint, but I will open it up so that if anyone has any questions.
Awesome. While people are unmiking, you know me, I always have questions. So Harriet House and Mary's, Harriet House and Mary's Sanctuary are two separate.
So it's all the same organization,
right?
We just call the residential program Mary Sanctuary.
Okay. And during the presentation, so it was public-private sort of donations and collaboration.
Yes. So we have funders that came alongside of us that gave us some funding. And then we also received a grant from the governor's office for 2023.
Wonderful. And I have several more, but please unmic or drop in the chat. I was very curious when you talked about the drop-in center, you know, how you started. Were you seeing any labor trafficking survivors or labor exploitation that you could talk about?
We haven't seen any that were directly related with that, but we have recently added to our staff someone who's bilingual. So we would like to expand our services into the Spanish speaking community so that we can have more of an idea of what's going there, because we do have a lot of crab picking houses that are here in our county and across the Eastern Shore. There are a lot of migrant workers.
Right.
So we feel like we want to expand our services into that community so that we could see what issues are arising there.
Right. Norberto asked, are the services for all Marylanders?
Yeah, so we do have, we take referrals from anywhere. So anywhere across the United States. We're not limited to where we could take referrals from. So yes, we take referrals from any place.
And can you have pending cases? I saw that you can't be on, you know, warrant status, but
Yeah, you can have pending cases because we expect people that, you know, are coming out of those situations that they could have some pending issues.
okay, I'm going to stop, but I have more. But we see that Yamari has a question. Do you want to unmic, or anybody can just jump in and unmic? and
Okay,
ask?
sorry.
No, it's
Hi.
good.
I just had a quick question, just curious. There was a lot of requirements for I guess mental health situations. I guess they shouldn't, be suicidal and different things like that. But I'm assuming that a lot of these experiences are very traumatic for them. So how does that work? Are they given a chance if they have been dealing with those type of cases before, or have been in those situations before, or is it like an automatic denial?
No, it's just not that they're in a current crisis. So, when they come in, and we expect that there's going to be things happening while they're with us, because once somebody is coming off of, drugs and alcohol, and they're having to deal with the things that they have to deal with, there's going to be some of those things. So we do get them connected with therapy. We have people that are doing therapy that are trained with, crisis counseling. So, they will be a good resource for us as we get them connected.
So as long as they're willing to, push forward and make
Yeah.
those changes, it's okay.
Mhm.
Okay. Thank you.
And
I was
it's
just
not in a
curious.
current crisis.
Please jump in with questions.
Does it affect people from that's coming from domestic violence situations, or only trafficking?
Yeah, so it's for trafficking and someone who's been exploited sexually, because there are other resources in our area that are for domestic violence. So we wanted to make sure that we were covering an area that wasn't already covered. And I know that there is a lot of times overlap in that. So we will see people that have domestic violence as a history, because that is something that goes along with human trafficking.
Okay, thank you.
And I think sometimes we just need to look deeper into those issues of domestic violence, because it could just be hiding something else that's actually going on there. So we do talk with domestic violence survivors to see if there's more to that story. And it doesn't always come out in the beginning. So as we develop relationships with people and they feel more safe and comfortable with talking about the issues, those things could bubble up to the surface.
And if that would be the case, and they have children.
So right now we don't have the capacity to serve women with their children, but we do know that that's a need, and we're looking into, making that a possibility for our organization. We actually just had a strategic planning meeting at the beginning of the year and have several different focuses that we would like to do. So we would like to have an emergency urgent care home that would be more of a short term, so that it would help people right where they are without as many requirements. So a lot of those barriers to care would vanish. But then also for having programming for women and children, because we realize that women that have been trafficked do have children. And that's one of the things that keeps them from getting the care, because there's not a lot of resources that are available to serve them.
Thank you.
We are connected with resources across the United States, so that if there was somebody who wanted to go to a different area and they had children, we could definitely help get them connected. Because I know specifically of an organization in Iowa that has a program for women and their children. And they're currently adding on cottages that will be like a transitional housing for the women once they graduate their program.
Thank you.
You're welcome.
Excellent. I'm sure we have more questions. Please feel free to unmic or drop them in the chat. If not, I will keep asking questions. Well, while you're waiting, while you're formulating yours, Julie, for some of us who are maybe looking at really trying to jump into the housing idea, because we all recognize it is a tremendous need, not only in Maryland, but it is nationally. And
Yes.
there's sort of lots of different, we've heard, Andre talk about children, right? That's a huge need. Or we know with our transgender folks, we also know our male survivors. So now that you have embarked upon this journey, because I don't believe in reinventing the wheel, is there one or two lessons that you learned that you could tell us so that we get ahead of that if we are trying to start this? Like, give us some words of wisdom. How do we do this?
So this is definitely a process. And I just say to be patient in the process, because it takes getting the right people to want to support what you're doing. So for us, it took getting out in the public and doing presentation after presentation after presentation to get somebody who is like catching on to that vision and wanting to partner with you. So that was part of it. Definitely having your plan laid out, and being flexible with that, because we didn't realize that, we thought, okay, we're going to have to buy a place and all the things that go along with that. So we had a donor that came and said, hey, I have this house. And when we first went to look at it, it was like, oh my gosh, this thing probably could be pushed over right now with a bulldozer. But we'll see what we can do. And so we got the work estimated to see how much it was going to cost. And then we had funders that came and said, hey, we want to help with this. So but having support, having a lot of people to help, I think that's probably the biggest thing, is really aligning yourself with others who have either done this before that you can learn from. There's lots of other shelter programs across the United States. So partnering with some, we are actually in a mentoring and training program with an organization that was doing housing. And so now they are training other organizations to do the same, because they felt like it was a better way to reach more survivors, was to teach others to do it.
I bet it was
So,
Samaritan women, right?
yes.
Yes, they're fantastic.
Yeah, so we've
Yeah.
been in a mentoring and training program with them since 2019. And so they are really good about teaching you how to do all the things that you're going to do. So it was really good to have that support and have them come alongside of us and believe in us too. So, having that is really important.
Can you tell us a little bit more about Harriet's house, sort of the genesis of it? And because I feel like maybe we don't, what is Harriet's house? Not what you do, but
right.
Yeah.
So when we started this issue, when we started Harriet's house, I had actually learned about human trafficking back in 2008. And it wasn't called human trafficking at that point. It was just like, this is what's happening to women. I went to a conference. I saw a video of an organization that was providing aftercare for women that were coming out of brothels in India. And so it just really struck me at that point, like, I really want to help women in this way, but I have no idea how to do it. So I started to just study and learn about it, and thought that it was an issue that was only happening in other countries. So I started to do missions work and spent about 10 years going on short-term missions trips, going into other countries, just, serving people. And 2 of those trips were specifically to aftercare programs. So I worked with an organization in Cambodia and then another one in India, where I was able to see how they helped women. So what they did was they gave them a safe place to live, gave them the food that they needed, taught them a new skill so they wouldn't have to go back to that work. And so that was what I thought was really important, was teaching them, something else to do, get them a career, get them another path. And so as we went further, at one point I was working at a rape crisis center as an advocate. And so just learning more about sexual assault and how it affects women, and then human trafficking even more so. And it was in 2017 that my husband said, you know, why don't you just start your own thing? And I was terrified to do that because I didn't know how to do it, you know? So, you know, I took the plunge. We started the organization. We were trying to come up with a name. And I had heard about another organization, Courtney's House, and out of DC area. And so she was talking about how she named it Courtney's House because she wanted it to be like, I'm just going to a friend's house instead of saying I'm going to, you know, an organization. So I thought, well, that would be a neat way to do it, is to have an organization that's named, you know, after somebody and house. So I couldn't figure out a name. We were trying to figure out different names that we could call it. And we went through the Harriet Tubman Visitor Center that's located in Dorchester County. And it was a brand new facility that was opened up. And so we went through there, and there's a lot of things that you read about Harriet. And she was just such a strong woman of faith. She, you know, did everything she could to help others. And it just, that day, it just struck me. I'm thinking, well, why not Harriet? She's well known, you know, in our area and across the United States as the woman who led the Underground Railroad. And so taking women or men and getting them to safety, children. And so that's where the name came from. We decided to use her name. We have 2 T's in our name because we're in the state of Maryland and her name is precious. So they wouldn't let us use 1 T in our name. So we just added an extra T, and that's where the name came from and how we got started. So it's really been a bridge between the communities. To say that we're using, you know, Harriet's name to help people in this topic of what has been called not modern day slavery and human trafficking.
That's a beautiful story. Thank you.
You're welcome.
Wow. Do we have any other questions or comments? All right, it looks like, let's see, did something just, all right. And I think that's it then. I hope you can also stay.
I am.
Perfect. Thank you so much, Julie. It was
Thank
a pleasure
you.
meeting you and hearing
You
you.
too.
Thank you. All right, we are, I know that, I believe I've seen Jessica Foster. I think she's here. Okay, excellent. So we're running ahead of time, 5 minutes, but that's fine. So let's all stand up. Yes, I know I'm being annoying, but I sat probably for 5 hours yesterday, and thank you. Look at you, Danielle. Thank you. Let's stand up. Oh my goodness, it's so easy to sit and you don't know where the time comes. All right. Oh, we need Dr. Elizabeth here today to take us through some yoga, some chair yoga. Although I don't bend or stretch the way that you do in yoga. For some reason I can't do it. All right. Oh, yes, exactly. Well, awesome. Well, thank you. Next, we are excited to hear about what Southern Maryland is doing. So we have Jessica Foster from the newly formed Southern Maryland Human Trafficking Collaborative, and she's going to brief us. So thank you, Jess.
Yes, absolutely. Thank you for allowing me to share about our group. I have been so excited to hear the presentations from yesterday and this morning to hear about the great work that's already been done, and it's giving me lots of ideas for where we can go with our group. So my name is
Jessica. Are you still good with recording? Am I good?
Yes, that's fine.
Okay, sorry to cut you
No,
off.
that's okay. My name is Jess Foster. I am the Victim Services Coordinator with the Charles County Sheriff's Office. And I want to give a shout out to Sharon DiMaggio. She actually was key in starting this group through Calvert County and getting the stakeholders to the table to really start our group. We are brand new. We started in February of 2022, so just last year. And Sharon and I had several conversations where we really noticed a gap in services for victims of human trafficking in Southern Maryland. So we brought the stakeholders to the table. We invited folks from St. Mary's County, Calvert County, Charles County, from law enforcement, from state's attorney's office, from several nonprofits, health departments, you name it. We tried to get everybody involved. And we recognize that while the volume of trafficking may not be the same in Southern Maryland as some of the larger counties, it's still happening. It's still there. So we need to address it. We have kind of discovered that we really need to focus on one, education. So how can we help educate our communities down here in Southern Maryland? What does or what can human trafficking look like? Because we know it's many different things. And what can we do to serve the population? And awareness. How can we do different outreach events for first responders, for nonprofits, for the hospitals, for schools, to really help us look and see what is out there. And then resources. So we really wanted to see what is available in the Southern Maryland area. There is a lot of overlap in our services in this Tri-County area. So we realized that our services for victims of human trafficking were going to overlap as well. So instead of kind of doing one county, we wanted to come together and do that together. So right now we are discussing data and protocol and kind of what does it look like in the Tri-County area. We recognize that there is not a specific response to human trafficking and those types of situations. So how can we develop that protocol? What does that look like? So that's really where we're at in bringing those players to the table and developing that. And looking at the data. And so that's really where we're at now. Sharon has been great about connecting us with different community partners and doing outreach. We have a victim services partner in St. Mary's. She actually just switched to a different position. So once the victim services coordinator with St. Mary's comes on, we'll get them on the same page and get things going again. So, you know, so far, though we're new, we're very excited about where we are going. We have collaborated with the PG Human Trafficking Task Force, and you all have been so gracious in kind of mentoring us and guiding us so that we can continue to make that difference in our communities. We've gotten great response from our partners in wanting to address this gap, which has been very exciting. I know, speaking from my own agency, they are excited about creating this protocol that will help further enhance the services that we're providing our community. So we're new, but we're ready to go and excited about what this group can do to continue to bridge that gap. Does anyone have questions about what we're doing here in Southern Maryland?
Don't be shy.
Or Sharon, if you want to jump in and say anything that I missed.
I will jump in. Thank you so much, Jess, for taking the lead on something that was started and The value of it is just so great, and it just so made sense for a larger county rather than Calvert to take the lead on the collaborative, and you're doing an amazing job, and I'm so grateful. And, you know, I'm always here to work with you in any way. And just everything you said, I think you did a great job representing how it came together and what everyone's trying to achieve. And definitely, because our volume, and that's what we hear all the time, it's not reported, it doesn't happen here. And we know that just because it isn't reported doesn't mean it's not happening. And so just thank you for, you know, taking the lead, and I'm just thrilled that you're able to represent Southern Maryland today at this conference. And thank you for everything.
Thank you, Sharon.
I'm sorry, go ahead.
No, I'm sorry. I wanted to add to one of the big things, echoing what's been said, of course, housing is a huge need across the whole country, but we also recognize that some of our housing options that we do have in Southern Maryland may not be equipped to handle the trauma or medical needs that we may see with this population. So that is another key thing that we want to address. And we can certainly help refer to other areas, but if we can address what is needed in our counties as well.
And I wonder, you know, we know that for labor trafficking, there are industries that are particularly vulnerable to that sort of exploitation, whether it stays exploitation or whether it slips into trafficking, right? That fine line. I wonder if you could maybe sketch for us what sort of industries there are in Southern Maryland, Calvert, St. Mary's, and Charles County.
Yes, so we actually, a big one that we see these challenges with is the nail salons. I've talked with one of our lieutenants about some things that they've been doing with that. So we see the nail salons, the massage parlors. I don't know if Sharon, if you have seen some of the larger farms down in Calvert or St. Mary's. I haven't personally, because I think they're more just family run, so we don't see the farming down here.
No,
Do you have anything to
we
add
don't
to that?
either. We haven't. As a matter of fact, I've been with the agency for 13 years, and I'm only aware of 3 human trafficking cases in 13 years. So, and none of them were farming related.
Okay. So yeah, I would say the nail salons and massage parlors, those are the biggest ones that we see, especially with the labor trafficking.
Yeah, and we also know, I guess in St. Mary's, there's a sort of military, Pax River, or you know, we know that those also create sort of spin-off industries that are vulnerable to particularly sex trafficking. Also, I guess we know, right, in closed communities, that there can be elevated levels of domestic violence. And we know that domestic violence and human trafficking can coexist, or that one sort of drives the other. And I know, you know, we have large sort of closed communities. By closed, I mean like sort of, you know, our Amish community and different in Southern Maryland. And I know that we don't typically, you know, look in closed communities or think about that, but I'm just sort of talking to myself as well, because we know that closed communities do have very special vulnerabilities because they are closed.
And one of the things I think of is we do have the Chesapeake Beach Resort does have that really small casino.
Yeah.
So as Renee, this sticks with me. When I first reached out and we connected, she had told me, she said, you know, just because it's not being reported, she said, as long as there's sex and as long as there's greed, it's happening. And it's happening in Calvert County. It's just, if it's not being reported, you know, it's not in the forefront. But I agree for sure. And then you have the whole familial trafficking, which is a whole nother thing. And you know, children can't self-report. It's left up to teachers to recognize something unusual or, you know, people involved with the family. But I do wonder with that casino, you know, just even though it's small, if there's an element going on, most likely it's sometimes.
Yeah.
And then like Renee had said, the cross jurisdictions, you know, that just there's no boundaries. So it's so awesome. Thomas Stacks invited our county and our team to participate with the Baltimore city meetings. And then with the Prince George's County meetings, we're just really grateful. And Anna Rundle had also joined with us. So yeah, we've got a lot to learn here. But you've really helped us tremendously. Thank you.
No, we're all in it together. That's the point, right? We're all in it together, and there's no reason that you have to start at zero if we can all help push you ahead of us by learning what, you know, what not to do, or, you know, some of our lessons, so that you start in a much better place than some of us did. So we are all here for you. I think that's what's important.
Thank you. You've been amazing.
Yes, thank you. And speaking of the kind of the groundwork that's been laid, just hearing some of the programs, some of the task force and so forth that are laid out already, you know, does give us several ideas on kind of how we can be most effective. So I appreciate that very much.
Outstanding, outstanding. So if there are any other questions, please feel free to unmic.
I have a question. So like if we, you mentioned I know the spa parlors are mentioned several times, and I can get that. But what about the nail salons? How can we spot that there is something weird going there?
That is a good question. I know that in our county, my lieutenant that I've been in contact with, they have worked closely with the nail salons. So to be honest, I don't know exactly how they are navigating finding out where the labor trafficking may be occurring. I don't know if there's anybody who can speak to that.
Well, I can offer a couple of things just from my state's attorney's days. There's certain things we as customers can look at. One, we know that the state of Maryland license every operator who's at hair, nail, has to have their own separate license. So if you go to a place and you see the license, everybody has to have their own individual picture and license on the wall. Now there are exceptions for like, you know, training period, sort of 90 days. But if you go in and you keep seeing the same generic license on the wall for the business, that does not cover everybody. So sometimes that's a sign like there's something else going on, because the people that are working here are not licensed through the state of Maryland, i.e., ergo, that means it's illegal, right? So there's something going on. Maybe it's labor trafficking, maybe it's just exploitation, but whatever it is, it's not legal. And so if you go to a place over a period of time and you recognize, you know, or you're sitting and you see that the operator who's doing yours doesn't have their license, it has to be displayed at their station, that can start to be a signal. Just kind of watching, and Andrea has her hand up. I'm sure she can tell us a lot more. You know, just watching and seeing sort of how the interactions are, you know, if you go there, are people working, you know, at 7 in the morning and maybe you drop by at, you know, 10 at night and that same person is still there. Does it look like people are actually living on site, right? Because I've gone on search warrants where, yeah, there, you know, there are the mats in the back and the food in the refrigerator, not the food that you bring in every day, but food. Yeah. So Andrea, please.
Thanks. Yeah, I'm Andrea Nunez from Howard County. It was really great I don't think I've met you before. It's really great to hear from what you guys are doing. I wish you well. And I'm glad Renee helped me a lot when I started this job 3 years ago. Please also think of me as a resource if I can ever, anything at all, any kind of conversation. You're mentioning nail salons, which is interesting. I know I can say Howard County Police, has looked at, I think, developing cases there, as well as massage. We've seen that for decades in Howard, as well as probably much of Maryland. My question for you, since I don't know you're part of the state nearly as well, it's what ethnicity, what nationality workers are you tending to see in the nail, the establishments you're talking about? Because I think it's just interesting how it shakes out in different places. I can tell you in Howard, we've done a lot of, we've tried to do some thoughtful, worker-centered outreach to massage workers, because it's only about, it's less than 20 places. We are not a big, county as big as some of the others here. And we found kind of an even split between Chinese speaking women and Korean speaking women. So I'd be interested to know if you have unofficially kind of a different sense of who's working in these places in your jurisdiction.
No, that's a great question. You bring up a great point. And I also thank you for offering to connect with us. I would love to connect with you. So I'll put my contact information in the chat for anybody. But I would say that the massage parlors, I'm not sure the ethnicity that they're seeing. The nail salons, I would say we're pretty similar. We see, at least for Charles County, I don't know if Sharon and Calvert County, you see much of a difference. But we do our nail salons. I would say it's majority Chinese speaking, Korean speaking in most of them.
Cool. Thanks, Jess.
Yeah, thank you.
Hey, Jess, this is Tom Stack from Baltimore City. I'm a retired Montgomery County vice detective and worked human trafficking cases. I've done a lot of massage parlor investigations. You can reach out to me. There's a lot of different resources. One of the resources we have up in Baltimore City is the Maryland Board of Chiropractic Examiners, the massage board, who issues those licenses. We've used them extensively. I use them a lot in my investigations. They have an investigator who's really good. And also Department of Permitting Services, we use them a lot to shut down a lot of our massage parlors. And as far as ethnicity, we found that a lot of our massage parlors early on were Korean. And then when we shut them all down, they came back, they resurged, and they were all Chinese. So they're all of them in Montgomery County are Chinese run right now.
Thank you for sharing that information, and thank you for continuing to connect with us while we grow our group down here.
Excellent.
Hey,
Yeah,
Tom
we're on-
Stack, though. Sorry, Renee. What are you guys seeing in Baltimore City, though, in a very different jurisdiction than Montgomery County in terms of the breakdown? I don't know that I've asked you that before.
We don't have as many. We don't have as many as the counties do. We have other issues that are going on in the city with like street prostitution and different our hotels and stuff like that. So we only have a handful of massage parlors in the city, and I'll address that when I give the Baltimore City update. I don't want to take any more time away from our Southern Maryland folks.
Wonderful. We also see, and I see Danielle's hand is raised, and Prince George's County in the past, we've seen sort of the Asian brothels, but also Latino brothels, very much so. Danielle.
Thank you. So my question really is open to Jess or Tom or anybody that would like to ring in. But what about labor trafficking in restaurants? There's a sushi restaurant I love to go to, and I had learned, that the owner provides worker housing, and I'd commented to a friend, oh, what a great thing, and that I used to be at a company where we were working to bring in affordable housing in Sarasota County to serve manufacturing, but the friend had said, maybe it's not a great thing, maybe it's human trafficking, and really gave me great pause knowing the owner of that restaurant, but thinking, in terms of restaurants, what are some good things for us to look out for? What are some good ways to help? Without putting undue scrutiny on restaurants that are not trafficking folks.
Yeah. I think I saw Tony's hand up and then back to Danielle.
Oh, yes. Good morning. I was just offering any help that you guys might need down in Southern Maryland. We do have quite a bit of massage parlors here in the county that we're dealing with quite a bit, and we see some of everything. So we're here for a resource. I've even worked with some of you guys, Sheriff's Department once or twice for some matters. So glad to lend a hand.
And so Tony is one of our vice intelligence officers that's on the ground working.
Thank you so much. And again, I'll put my contact information in there. And I know to speak to Danielle's question about the restaurants, I don't know if anyone else might have a better perspective on that than I would.
Okay.
I just see in restaurants, there's a lot of Latinos. Some of the people that I see, most of the people that I see, they work in restaurant extra hours, long shifts and stuff like that. And with the nail salons, what I do almost an intake when I'm doing my nails. I talk and ask questions and see what they tell me, if they have family and stuff like that, to see if they're doing well. I don't know, but I live in Virginia though. But I think like Mr. Hill, Officer Hill, that was saying that he's working with some parlors. It will be, I think, a general idea for me. It would be helpful to have general ideas of how we can catch that. I mean, if we see that something is weird, how we can report. Where do we report? I don't know.
Yeah. Can we do this, Audrey? Because those are great questions. We're going to have a little time just at the end, because I think that's important. So let's not forget that. Caitlin, if you can remind me, but I think Ashley, our next speaker, has time constraints. So I want to be able to get her on so that she can share with us before she has to go. But if everybody stays, we can continue this. So thank you. Thank you. All right. Thank you, Jess, for your report. We're next going to hear from Ashley McCree. From the Baltimore Human Trafficking Working Group. She's going to share briefly what they're doing. She is a forensic nurse examiner from the SAFE program from Greater Baltimore Medical Center. So thank you, Ashley, and sorry we ran a little bit over.
That's okay. Good morning, everyone. Can everyone hear me? Okay, perfect. So first, thank you so much for inviting me to speak today. I love the collaboration across the state. It makes me really happy because what I've found in the past in this line of work, there's a lot of egos that can be involved sometimes. And it's so nice from the experiences that I've had. Everyone has been so wonderful to information share. I see Tom Stacks on here. He has been so helpful to me in the past. So I'm from Baltimore County, and a lot of our what we see and trends that we see might go past the jurisdictional line. So it's very important to have these open communication with other jurisdictions. So I found that very helpful. So I love that you're doing this and asking some other collaborations to get together just to kind of talk about what they're doing. So again, I'm Ashley McCree. I co-chair the Baltimore County Human Trafficking Work Group. We were formed in 2018. I have been the chair since 2020, right before the pandemic occurred. I became the chair. So it has had, some barriers there and some issues that we've had related to the pandemic. But I'm just here kind of just to talk about our work group, what we're doing, some things that we have accomplished, and then some goals for the future. And then again, I'm also a forensic nurse with GBMC SAFE program. So we treat patients who have been affected by human trafficking, sexual assault, domestic violence, and child abuse. So I also want to talk just a little bit about our program at the end. So again, we were created in 2018. We have a great multidisciplinary team that includes law enforcement, state's attorney's office, juvenile services, child protective services, our school system, which is a really important stakeholder to get involved in these conversations, our local CASA group, victim service agencies, and then healthcare representatives. We also began piggybacking our regional navigator meeting with our work group meeting, because we found that there were a lot of the same members attending both meetings and a lot of information being repeated. So we found it was really helpful just being cognizant of everyone's time, just to kind of join those meetings together. So that's something that has been helpful in our jurisdiction. So some things that we have accomplished. My big push is for community awareness. So in 2021 in January, for Human Trafficking Awareness Month, we offered a 4-part webinar series. It was geared towards community members and just to raise awareness about human trafficking. It was really successful. We had, I think over the course of the 4, we had, I think over 1,000 people that attended the webinars. And we included a Human Trafficking 101, information about child sex trafficking, the complex needs of survivors. And then we ended with a panel discussion that included representatives from, again, State's Attorney's Office, law enforcement, CPS, the school system, victim service agencies, and then a survivor leader, which we all know is so important to have a survivor voice when anytime we're discussing trafficking. We were also able to offer this webinar with the exception of the panel, with a Spanish option, which we found was really helpful because one of the trends that we have seen over the last few years is the increase in Spanish-speaking human trafficking victims and survivors. So being able to offer resources and trainings in Spanish is really helpful. Last year, we received a really generous donation from GBMC, our local hospital, to develop awareness materials. So I can show you a few of those. And if anyone would like me to email this to you, I'd be happy to. Just if you are developing your own awareness materials and you would like to use anything as a reference, you can feel free. But let's see. So we developed a table skirt. We developed, this is a pop-up banner. This is so amazing. It's very eye-catching. It's probably about 8 feet tall, and we use this right next to our table. Here is our trifold brochure. So it has a lot of information about what trafficking is, how to spot it, questions to help somebody that is suspicious of it. And then really important is what to do if you suspect trafficking. We all know that there might be some misunderstanding about how to approach a trafficking victim, and it might be putting the victim or that person that's concerned in more danger. So we wanted to address that as well. This is my favorite. This is our badge cards for healthcare providers. So we made a couple thousand of these that we're passing out to all healthcare providers that we can get into contact with in Baltimore County. And it's great. It's like the same material as a credit card. It's really hard plastic material. It goes right on our badge reels as healthcare providers, and it has the definitions, red flags, what to do if suspected, some different tips like safety tips are on here, and then also reporting requirements, because especially with healthcare providers, it's so hard to train and keep healthcare providers trained because there's so much turnover constantly. We want to make sure that the victims that should be reported by law are being reported, and we are compliant with our mandated reporting laws. And then also we're not reporting against somebody's wishes if they are an adult and we're not mandated to report. So we want to make sure, because there's a lot of misunderstanding about healthcare providers. They think that if it's human trafficking, it's a mandated report, and they don't understand that they might be putting this person in additional danger. Let's see, we have shoe cards for victims or survivors. And then lastly, we have developed just some small pocket cards. These are about the size of a business card. They have a lot of information on there. And we are going to use that for our future goal. We were asked to provide training to all first responders in Baltimore County. And not just a one-time training, but regular training. And that's something that Tom Stack, again, has helped me with because I'm sure he'll talk about that in his presentation, but they offer first responder trainings regularly. So they were able to help us with kind of how to get that started. And then this year for Human Trafficking Awareness Month, we've been really focused on awareness in the hospital setting. So we were able to gather all of our materials that we just got developed and get into three hospitals in Baltimore County, setting up tables and just passing out awareness materials and talking to different healthcare providers. Let's see. And then our goals for the future, just continue to assist with policy development in different agencies, and mainly the healthcare system is my goal. partly because that's the system that I work in. And just making sure that all of the healthcare systems and hospitals in our county have a consistent approach to human trafficking. So it doesn't matter what hospital a victim or survivor goes to, they're going to get the same kind of help. Okay, and then just quickly, here is a photo of our SAFE unit at GVMC. So we have a really great unit there that human trafficking victims can get treatment at. We have 2 exam rooms, which is really nice. So that prevents a patient from waiting if there is another patient in our unit at the same time. We have, we're really concerned about safety, obviously, for the patients that we treat. So we have a private entrance. We have a private waiting area. We do have the ability, as long as the patient doesn't need emergent medical care, they can actually bypass the emergency department and come straight to our unit with a designated parking spot and through a private entrance. And then get triaged and medically cleared all in our unit. So they don't have to be in and out of the emergency department. So that's been really great for especially our human trafficking patients who have a fear of, going into other areas of the hospital. We do have an interview room. So if police are notified and would like to interview the patients in our unit, they don't have to be transported to the precinct. So they can be interviewed right in our in our unit. Another cool thing, when we were developing this, we have a special interview room that allows for audio and video. So if we do have our Child Advocacy Center staff members that want to come and interview a child and actually complete an actual forensic interview, we have that capability for them as well. Okay, so that's all I have. But again, thank you so much for the opportunity to speak today. And I just, again, love the collaboration. Does anyone have any questions?
Yeah. Let's see. Andre says, these materials are all great, Ashley. Any chance you'd be willing to share copies we can use in Howard and give you Baltimore County credit for? Question.
Absolutely. So like I said in the beginning of my presentation, is that unfortunately sometimes there is some ego involved in this kind of work. I have 0 of that, and I've been very lucky to work with people that have 0 of that. So I'm absolutely, willing to share anything that I have. As far as materials, like our policy for our hospital, if you have hospitals in your area that do not have formal policies, which I'm sure you have plenty of them. There was a study from 2020 that showed only 1% of hospitals in the entire United States had a specific policy for human trafficking patients. So I'd be willing, anything that you need that I would be able to help you with, I'd be absolutely happy to share.
Awesome, thank you. Are there any other questions or concerns for Ashley? Not concerns, but yeah. Oh yeah, concerns that you may have in your own jurisdiction.
I'll take constructive criticism as well.
Yeah, that's not what I meant. As I said it, it's like, that's not. Thank you. English apparently isn't my language.
I can also put my email in.
Yes, that would be awesome.
So if anyone does have any questions or need anything in the future, please feel free to reach out.
Thank you, Ashley. That was really, really enlightening. Thank you.
Thank you.
Wonderful. Okay, we next have Lieutenant Paul Sims from Mount Rainier Police Department. Just by way of context, Caitlin and I have started reaching out to each of our municipalities within Prince George's County to really ensure that that everybody is collaborating. We have our Prince George's County Police Department, which is the largest police department. We have our Prince George's County Sheriff's Department, which is the oldest consistent running sheriff's department in the United States. Yep. And then we have at least 26 municipalities, many of whom have their own police department. So there are lots of moving pieces. Of course, we also have federal partners here with federal buildings who then have their own force. So we've got lots of things when it comes to law enforcement. But on one of our journeys recently, meeting with Mount Rainier's leadership, we had a wonderful conversation with Lieutenant Paul Sims, and he had a wonderful story that he shared with us. Hopefully he can share it here, but we asked him to come and talk about human trafficking, and it may sort of answer some of the questions about how we engage and what we do. So Lieutenant Sims, thank you and welcome.
Thank you. Good morning. Well, it's already been introduced. Lieutenant Paul Sims, Mount Rainier Police Department. I grew up here in the Washington, D.C. area. Graduated from Archbishop Carroll. So I'm pretty familiar with the area. Began my law enforcement career after a good stint within the Army. Started my law enforcement career in 2013. So I've only been with this agency for 10 years. One thing outside of here, shameless plug. I teach human trafficking self-awareness with my company, my brother and I, called PACS, PACS, Personal Awareness and Combative Strategies. So we teach everything from being aware of where you are all the way to how to defend yourself in that sense. But we look at the first thing as being awareness. We really started to dive into the human trafficking piece for sex trafficking, labor trafficking, human trafficking, including the purchase of infants, okay, of babies and human purchasing per se. Because it really is, it's larger than what most people may realize or what most people may know or think. You're talking about an over $5.2 billion industry a year. We used to think that that was drugs. We used to think that it was gun running, drug marketing. It's not. Human trafficking is the biggest source of income for this type of illicit income right now. So what happened to me, as Renee was talking about, is I was
Sorry, Lieutenant Sims, just before you get into details, we are recording. Is that okay, or do you want me to stop? Okay,
That's
sorry about that.
Okay. Was in my city, was in my cruiser, which of course is unmarked, and happened to go to one of the local stores. And while in one of the local stores, I have a mask. And most times when you think about human trafficking, you think about the normal, or most people think about the normal stereotype of person that is being trafficked. Either they're young and model-like, or it's an infant, or it's someone who's foreign, who doesn't speak the language where they are, or that they have to cross state lines or out of country type deal. That is not true. Well, there's also a very underreported group. If any of you have ever heard of MMIW, which is the Missing and Murdered Indigenous Women. And so you're talking about indigenous natives who have turned, and their numbers of their women are being underreported or not reported. Some are either missing, and as the name implies, are being murdered. That's due to trafficking. So they have a sign or a red hand that goes across the face. And there's a mask that has that on it. Just so happened this day, I had that mask on. My family I have indigenous heritage, okay? Blackfoot to be directly specific about it. And this young lady and this guy walks in, and she notices my mask. But I notice she's kind of timid. Some of her body language is telling me something's not right. And she puts her hand up to her face in the same symbol of how my mask is. She did it twice. That lets me know, something's wrong. So when looking at her and seeing some of the things she was wearing and some of the way that she positioned herself, or some of the things she was saying and listening to her, it came down to it where I figured out that she was from my tribe. So I spoke to her in our language, which saying okay means hello. And let her know pretty much, I'm a friend, are you okay? And she replied that, she was not okay. This guy pretty much, had gotten off the train. She got in a ride with him because he offered, and he was not taking her immediately to where she wanted to go, and she was scared. He must have done some things to her while in the vehicle where she was not very talkative. I had to play it to him. Look, I'm not trying to, talk to your girlfriend. We just have something in common, and I don't really see my tribal people out here often. So it was just nice to meet her. Long story short, to make this really short because of time, it ended up being that he had picked her up and had other options. It had other things in place. Well, we went to go sit in the back of my cruiser while he finished shopping. And when I raised it up, you can't see the lights. It wasn't until, he figured out, or I pretty much let him know that I was a police officer, that he, all of a sudden, he had to go to the store. He had to go get something. He had to, I need to go away real quick. His words to me was, he told her he had to hurry up. He got called into work and he couldn't take her where she needed to go. And he had to hurry up and leave. Well, her phone was in his car. So we called her phone. The app on law enforcement phones allows me to copy any number I want. So he didn't have my direct number. And I told him, hey, look, here's the deal. Her phone is in your car. She needs to call somebody. You know, can we meet you to get the phone? He walked around the corner, gave the phone, he sped off. Said that to say is that sometimes even the smallest, slightest things from your own life experience may help you identify or to be able to see some of those who may be trafficked, or to give you an insight as to what happened, because not all the time will they reach out unless you have something in common, or they feel that they have something in common with you because they're scared. They don't want to talk. 9 times out of 10, they'll be told not to talk. If you look around, especially in PG County, for those who are in PG County, I'm not sure about other areas, you'll see these signs on these postings that say, babysitter wanted, grass cutter wanted. It gives only a phone number, doesn't say where the location is, doesn't say the age. Why? And there's some that I've seen that say babysitters wanted 12 to 14 years old. Why is the sign specific about a 12 to 14-year-old babysitter? And it'll just have the number. Well, the thing is, you call that number. You've seen, I'm sure we've all seen the signs that says models wanted. Have you ever wanted to be a model? And you just have a number. Well, what they do is, if you haven't seen how that works, there's a movie that pretty much goes really into detail about some of, because it was actually consulted with someone who survived it. But they get the aspiring model. She goes in for a model shoot. There's an order form that's filled out. And if you wonder what that order form looks like, do me a favor, go look in the mirror. There's an order form for you. Men, there's an order form for us as well. That form is given to somebody, and when they come back, they look at everything, and that's how they select. You think that you, out of 100 people, only 10 models were selected. No, they just met the order form. So now they're taking somewhere where they either in-state or cross-state lines, and then all of their identification is taken from them. We need a copy of your license, your birth certificate, your social security card, and if you have a passport. Don't make a copy of it. Give it to us. We'll make a copy for you. Then they never get those things back. So now how do I prove to law enforcement who I am? How do I prove to someone else who I am? Renee talked about the licenses inside of the nail salons. That's 100% on. It's supposed to be for every individual operator. If you happen to go in and notice that there are 20 tables inside of this nail salon, but only 5 people working, 9 times out of 10, that's kind of like a clue. If anytime you go in, there's only 5, but there's 20 tables, it means those tables are open just in case they have more people, and they'll bring more people from the back, or if they need an influx of, they have an influx of customers, they're going to bring somebody who's being trafficked for labor or whatever the reason to come and fill those slots. That day was really worries. It worried me a little bit, because the only reason why she reached out or said anything was because she saw my mask. So it starts to become a thing of how often have we probably been reached out to where we didn't know it because we just thought, that seems weird, but we're really not going to say anything. That looks out of place, but I'm not sure. And that's how some of this stuff really gets passed. And that's what the traffickers are hoping on, that we do not pay attention to it. So that's some of the things that we teach with PACs, and as law enforcement, that's really some of the things that we teach, just about being aware of what looks out of place to you, or what seems out of place may indeed truly be out of place, but they won't. It's very hard to get those who are being trafficked to say anything. And sometimes they're being threatened, and you don't know how many of the team is around. The recruiter, the best friend who says, let's go to this party and put something in and drink, the order taker, the enforcer, the person, if you try to get in between, will pretty much try to get rid of you, as well as any other type of muscle or high security that may be around. One part of it too is that sometimes the traffickers get so involved in it, they start to identify with the trafficker, those who are being trafficked. R. Kelly's, the 2 young ladies who they last talked to, perfect examples. No, we're both in a relationship with R. Kelly. No, we're both his girlfriend. No, he didn't do anything. No, these things aren't. Those type of things can happen. I'm not sure, I want to be correct, but I believe they call that the Munchausen syndrome, where they sympathize and start to get get along with their trafficker or their abuser. So those are just the things that we've noticed, both on the law enforcement side and with teaching this outside.
So thank you, Lieutenant Sims, for just giving us a real life experience. And for those who maybe the conversation that Lieutenant Sims had with this young lady was all in the language that they both spoke from the Blackfoot tribe. And so the person who the order taker, right, who was going to deliver her somewhere else, and she didn't know this, right, is standing there, but it's not understanding what they're literally not understanding what they're talking about. So you intercepted something before it could get to where it was going to go. And she was a young lady in what age range?
You're talking to somebody, she looked at appeared like she was between 18 and 20. She did not really, she was going, I'm going over somebody's house. That's it. Catching the metro. And we all seen people waiting for you at the metro outside of the grocery stores. Hey, do you need a ride? They're not necessarily Uber. They were Uber and Lyft before Uber and Lyft was around. We've all seen them at the metros, at Union Station, the stores. Hey, you need a ride? I'll give you a ride for $5. When we had that big snowstorm, people were doing it then. $20, I got an SUV. I'll take you from point A to point B. Man, that was scary for her, but be able to have that conversation was actually, it was a little bit exhilarating, like, okay, this guy's about to, let me see what's going on. But then to hear her say that, what was going on that's when things started to get a little.
Excellent. And there's a question, what is the name of the movie? Trina Payne wanted to know.
So the name of the movie is actually called Trafficked.
Okay. That's good to know. Thank you. Are there any other questions, or you can unmic if you unmute if you just want to speak, or drop it in the chat, either way.
Hi, can you leave your contact information with us? Is that a possibility?
Yes, I can. I'll put it inside of the chat for you. You want work-wise or?
Yes, please. Whatever you use when you want to, or when you speak professionally about your knowledge about this area.
Wonderful. All right. Thank you. Thank you for that. As I said, real life example, something that happened not so long ago, and just a reminder to all of us about being aware. So thank you. Oh, Danielle, hand raised. Sorry, please speak.
Lieutenant Sims, I was wondering, can you share, are these signs of trafficking followed up, such as, babysitters wanted, a phone number, babysitters wanted 12 to 14, that sort of thing? Are those followed up by human trafficking task force and law enforcement? I was curious. Thank you.
You're welcome. Thank you for your question. On our side here in Mount Rainier, we see them. We take the signs down. What we have noticed, if we call those numbers, the moment that it is picked up that it's law enforcement or they have met kind of their quota, the numbers change. These numbers are not assigned to cell phones. They're assigned to Google computer numbers. So the moment that you turn around and you call the number, it's as simple as going on Google and asking for the number to be changed or changing the number themselves, only because, and it could be for any reason, something doesn't sound right. And they're getting very, very, very smart. If the conversation does not sound right, if you do not sound like you're 12 to 14 years old, if you're asking too many questions, they change the number. So it's hard to track them down. Not impossible. It's just hard to track them down because they are becoming smarter with their tactics. They're becoming a little bit more close and tight-lipped about what they're doing, where they're doing, and how they're doing it. And by that, I mean, now instead of seeing those little signs, you're now getting things on Facebook. We've all had the ghost messages where somebody turns around and says, hey, how you doing? And it looks like somebody who you know. Or they turn around, hey, I got this wonderful opportunity. Have you ever been interested in this? Or, hey, I like your pictures. You look like a model. Would you mind if I take some pictures of you and put them up on for this reason? Those type of things, those tactics come across as very, very innocent. And so they become very, very hard to pin down as an actual tactic. It's better to be safe than to be sorry. So those type, with my agency, we do look into them. We just had one where somebody said that they thought that they saw someone grab a little girl by her wrist and pull her into the bushes. And they thought that so far as trafficking wise, that this little girl was trying to get away from them. No, what actually happened was mom was scolding young lady for turning around and acting up in public. But we still checked it out. My officer still called me, and we went through, looked at cameras and everything else from what we can see, because it is something serious and you just never know.
Yeah, that's a great question.
Thank you, Lieutenant.
Any other questions for Lieutenant Sims? And Caitlin has dropped in his PAX training, as well as Lieutenant Sims dropped in his Mount Rainier Police Department email. All right. Well, thank you so much for joining us and for sharing. And we hope to see you at the next Law Enforcement Committee.
Yes, indeed.
I always do that in front of witnesses. I'm sorry, go ahead.
No, I'm gonna say I have another meeting that I'm actually hosting here. Just want to say, everyone have a good morning, and please feel free to contact me should you have any questions, concerns, or just want to talk more.
Perfect. Thank you. All right. Moving on. Last but certainly not least, we have Tom Stack, who's a rock star. Everybody knows Tom. He is the Anti-Human Trafficking and Sexual Assault Response Manager, the Mayor's Office of Neighborhood Safety and Engagement for Baltimore City. So welcome, Tom. Thank you.
Thanks, Renee. And I don't know about that rock star stuff. Throw that in the trash. Just trying to do my job. But good morning, everybody. We're still in the morning. Thanks for having me. I appreciate it. So those of you who don't know me, I'm Tom Stack. I'm the anti-trafficking coordinator for the city of Baltimore and working out of the mayor's office. I'm also co-chair of the Baltimore City Human Trafficking Collaborative, which is our citywide task force that we formed 5 years ago when I was hired by the city of Baltimore. Prior to that, I worked for the state of Maryland, working at GoCap for about 2.5 years. And my background before that is in police. I was a detective for Montgomery County Police. I did 26 years in Montgomery County. The last 14 of that was in our Vice and Intelligence Unit, which kind of morphed into our Human Trafficking Unit. So I have a lot of experience doing human trafficking cases and also coordinating our trafficking efforts. So the Baltimore Human Trafficking Collaborative is a very diverse group of stakeholders. We have about 40 to 50 different stakeholders. We're always trying to add new people. We always have new people coming on board. We've had folks from all over the state. I know Renee, and you've attended some of our meetings. Sharon attends our meetings on a regular basis. And also Andrea comes to our meetings. So we're all inclusive. We welcome everybody because it's really important to share that information, because there's 1,000 ways to skin a cat. So we're always trying to learn new different ways. So within the Baltimore City Human Trafficking Collaborative, we have different subcommittees. We have a public awareness subcommittee that goes out, tries to do monthly or bi-monthly awareness events throughout the city of Baltimore. We have a legislative subcommittee that's working on citywide legislation, which we passed some really good legislative bills. Councilman Chris Burnett, who is the co-chair of the collaborative with me, is the chair of our legislative subcommittee for obvious reasons. And we passed last year. He passed legislation called Signs Everywhere, which requires human trafficking signs to be placed in every construction site in the city of Baltimore, restaurant, any city building, municipal building. It was pretty good. We have a law enforcement subcommittee, which actually just met on Tuesday. We had about 25 people at that meeting. We have a rather large law enforcement subcommittee meeting. Because we don't just have the BPD, we have our federal partners, which includes the FBI, Homeland Security investigations, also the United States Marshal Service, the United States Department of Labor investigators come to it. Customs and Border Protection come to our meetings because we have the cruise ships in Baltimore and also BWI. They're a tremendous resource for us. We have numerous state agencies to include the Maryland Board of Chiropractic Examiners, Attorney General's Office, State Police, and other agencies. Then we have a lot of city agencies. We do have the BPD. We have Maryland Transportation Authority Police, Maryland Transit Authority Police come to our meetings. But then the BPD, we have city school police, city sheriffs, but we also have other representation like our liquor board. Our liquor board investigators are awesome, and they're super proactive. They've all been trained on identifying the signs of human trafficking. They're going into all our strip clubs, they're going into everything, and they're allowed to search anywhere at any time. So they've been a tremendous resource for us. And then we also have our fire department, which comes to our meetings as well. We also have a victim services subcommittee, which is probably our most important, to make sure that there are no gaps in services for our survivors of trafficking. And our newest one is our medical subcommittee. So our medical subcommittee ties in all 11 hospitals in the city, all the different systems. We have Johns Hopkins, we have MedStar, we have Ascension Health, we have LifeBridge Health. It brings all these hospitals in together, working together so that we're all learning the same things. We're all teaching the same thing. That is chaired by Lieutenant Colleen Law from the fire department, and also Debbie Holbrook from Mercy Medical Center. And they go and do lunch and learns. They do grand rounds, trainings. They do all kinds of stuff, making sure that all of our hospital, all our EDs have appropriate training on human trafficking, and the fact that they are linked to our Blue Dot program. So some of you may have heard of our Blue Dot program that we started in Baltimore City back in 2019. And the whole reason we started Blue Dot was for our first responders, because as a cop, I know that a lot of times I would come across survivors of trafficking. It's not Monday through Friday, 9 to 5. It just doesn't happen that way. It's always 2 o'clock in the morning or 11 o'clock at night. You're making phone calls and you're like, no one's answering the phone. You're stuck in a hotel room and you're like, what the heck do I do? So we developed the Blue Dot program, and the Blue Dot program is literally, it's the gold standard for emergency services for trafficking survivors. It's been used. We've used it over 300 times since its inception back in 2019. It's a one-stop shop for trafficking. It's housed at Mercy Medical Center. It's available to our law enforcement partners, our other first responders like our fire department, other service providers, and all of our hospitals. The good thing about it is it's mobile, because they will go to you, and it's run out of the forensic nursing program. And it's very comprehensive. It's large. It's actually, we're very proud of it because we're in the top 3 for a national award for the White House Trafficking in Persons Award. So keep your fingers crossed. We should know something in a couple of weeks whether we won or not, which would be an amazing accomplishment for what we've developed up there. We take anyone. We've taken people from Anne Arundel County, from Prince George's County, from DC, Baltimore County. We take them from anywhere. So it's not just Baltimore City Blue Dot. So I know Tony Hill's on this call. Tony took someone to Blue Dot, called me up on a Veterans Day one day and said, hey, what do I do? I said, go to Blue Dot. And he took her up there, and they took care of that survivor. And when they get there, it's very similar to what Ashley's got over there at GBMC. That it's run out of the forensic nursing program at Mercy. It's safe. It's very secure. We make sure that all phones go on airplane mode. And when they get in there, it's all survivor driven. It's what you want. We have this to offer you, but what do you want? All they want is a glass of water, sleep for a couple hours, no problem. That's what you get. But you can also come back. We've had survivors leave and then like, you know what, I trust those people. And they come back like a week later, said, you know what, I need housing, or I need this, or I need that. One of the big things we have is detox, is we can get our survivors into detox. And they don't have to be trafficking survivors. They can be sex workers who are in need of assistance. Because of the vulnerability of those folks, we take them into the Blue Dot program also. We're not taking anybody off the street. You either have to be a sex worker or a trafficking survivor, whether it's, we've had labor trafficking, we've had some sex trafficking. It's an awesome program. And that's kind of led into, once we developed it, we started to do training with our fire department. And I know Ashley referred to this. The Baltimore City Fire Department is amazing. They've done a phenomenal job. They've trained every single, I started doing it, and then Lieutenant Law kind of took over from me after she kind of got up to speed as a trainer. And we've trained every single personnel person in the Baltimore City Fire Department on the signs of trafficking. And it's just been amazing to watch, because I remember sitting in a couple classes and, these guys are looking at this guy with a suit on from the mayor's office, like, who the heck's this clown coming in here? And next thing you know, you start talking to them and they're like, wow, this guy, he's pretty cool. Of course he was. And like, you know what, I've seen that. I've seen that, and I just didn't know what it was. So now you got the tool in your toolbox. And so our fire department, they have chapsticks that they hand out. They have the little the hand sanitizers with the 800 number on it. We didn't want to put a Baltimore specific number on it because we know that they're going to be in Baltimore tonight, and they're going to be in Philly tomorrow, and they're going to be back in Baltimore and then DC and PG County, and they're going to be. So we want that 800 number. So that way it's universal. And so they give those out. Our fire department is averaging 2 to 3 referrals to the Blue Dot program a month. I know it doesn't sound like a huge number, but that's just, those of you who have dealt with human trafficking survivors know that they don't self-report. And we teach these guys, tell them, I said, listen, you might come across 100 people. You say, I see all the signs. I see everything that Law and Stack taught me. It's there, but she doesn't want to help. Out of 100, you're going to get maybe 3. The rest of them, you're planting a seed, because we tell them all the time, you can take a horse to water, but you can't make them drink, right? But eventually that horse is going to get thirsty. And when the horse gets thirsty, we have the water, and the Blue Dot is our water. So they've done a phenomenal job. As a matter of fact, I just got an email this morning. They had a Blue Dot last night over one of the ambulance medical crew, like 2 o'clock in the morning. Again, 2 a.m. What do you do? Go to Blue Dot. That's where they take care of them. Also, out of the mayor's office, we have a grants program. Mayor Scott's been amazing. He reauthorizes this every year. So we've given out over $900,000 over the last several years to survive, to like turnaround and just nonprofits in the city of Baltimore working with trafficking survivors. We've done some, they've done some great work. We also like to have fun too. In 2 weeks, actually a week and a half, we're all going to the polar bear plunge. We'll be out there. Yep, we'll be out there. I see you, Renee. It's going to be cold, but we'll all have our Baltimore City Human Trafficking Collaborative t-shirts on. We're going to be out there. We're going to have a couple of drinks in the parking lot, build some courage up, go in there and jump in the water. It's for Special Olympics. It's also run through the Maryland Human Trafficking Task Force. Some of you probably have already seen that. You're welcome to join us. We're going to meet at 11 o'clock over at Navy Marine Corps Memorial Stadium to have a couple, build up some encouragement. And then we're going to go over there and plunge at 1 o'clock. And then our office also hosts the Maryland Human Trafficking Investigator Seminar, which is a, those of you who have been, I know Renee's been to the law enforcement one, but back when she was in her prosecutor days, that is going to be March 6th to the 10th in Ocean City coming up. We already have 225 people registered for that from all over the United States. It's one of a very small handful of investigator and prosecutor only trainings. There's just a couple of them in the country, and ours is one of them, and ours is free. So we have, I know Sharon's on here. Hopefully you're still on here, Sharon. You guys got 7 people coming from Calvert County. I love it. I saw all these folks registered from Calvert County. You got 7 from Calvert County. You got a prosecutor from Calvert County. You have a prosecutor from St. Mary's County. I saw signed up. We have folks from all over the state. It's going to be awesome. I can't wait to see those guys down there.
Great to hear.
And it's awesome networking event. And for those of you who are not law enforcement, don't forget, don't worry about it. We got you covered. October. I don't have the dates in front of me, but October at the we switched hotels. We're now at the Aloft Hotel on 45th Street. We'll have the Maryland Human Trafficking Professional Seminar that the mayor's office and Neighborhood Safety co-sponsors that. So don't worry about that. And all of our trainings we do are free. So there's no charge in that. So, like Ashley said, it's all about collaboration. That's why we're called the Baltimore City Human Trafficking Collaborative, because it's all about working together. So if anybody has any questions, let me know. If you guys, you have any law enforcement you want to get into the conference, let me know. I can probably sneak them in the back door. We'll get them in. But thanks again for having me.
Outstanding, outstanding. So there is one question here. Is there a link so that we can get more information on the Blue Dot program? That's from Talia.
Email me.
Can you drop it in the chat? And
yeah,
then,
I dropped it in there earlier.
Okay, and then Caitlin will send out, for those who dropped their emails in, when we send out materials from yesterday, we'll include all the emails. But
yeah, Debbie and I have trained all over the country on Blue Dot because it's a highly effective program. I see Julie on here. Julie's been connected with it. I know that they're looking at something on the Eastern Shore. But if you have a survivor, it doesn't matter where you are. I mean, if you're in Virginia, Pennsylvania, it doesn't matter, and you're stuck and you have nowhere to go, that's not true, because you always have Blue Dot. I mean, you might have to drive there, but we'll get you there. And they'll take you in. We actually had a survivor, a player's called. A survivor was coming from Chicago and her bus caught fire up on 95, and they're like, go to Blue Dot. So they sent them over, they brought them over to Blue Dot. So just email me, we'll set something up. It's a very complex the way they have it run. So it's not like I want a Blue Dot. It's not like everybody can have a Blue Dot, because it's you got to have the resources. And we developed Blue Dot before we started training everybody on it. And we almost perfected it before we started training, because we didn't want our firefighters out there like, oh, I got somebody, they want help, and now I make a phone call and nothing happens. So we wanted to make sure that everything was up and running. So like I said, Tony's used it. We've had folks from anywhere. I mean, everyone's welcome.
Wonderful. Jackie has a question. How do you respond to minors?
Minors, we work with our regional navigator. There's an MOU signed between Mercy and the regional navigators, which is at Center for Hope, which used to be BCAC. So they work together. They come into Mercy, they triage them, they take care of them, and then they hand them off to the regional navigator, and then also DSS. So we got to make sure DSS is also there as well. The one thing I forgot to mention about how awesome our Blue Dot program is that everything's free. There's no cost. Mercy eats it all. There's no insurance. There's nothing. They come in and say, if you got a broken arm, they fix it. They've held people overnight because of security reasons. They actually put somebody into ICU with asthma. I mean, how many people from asthma go to the ICU? But they did that because there was a threat. The pimp was looking for them. So they did it for security reasons.
Wonderful. Two quick questions. One, what are you guys seeing regarding labor, and what industries are you seeing, and what does it kind of look like in Baltimore City?
Well, I mean, labor, as we all know, labor's everywhere. There's not a person on this call that doesn't have labor trafficking in their jurisdiction. It's just a matter of finding it.
That's right.
One of the agencies I forgot to mention is our civil rights and wage enforcement. They're also involved in our law enforcement in our subcommittee. So they're out there doing. They've done a lot of education and training on wage enforcement in the city. So it's out there. We just got to find it. And I don't think there's been a single prosecution in the state of Maryland for labor trafficking with our new labor trafficking law. I mean, it's just
no, October 1st, 2019. But then
I mean, it's just,
I agree. Yeah,
it's hard to find. So we're going out there. The Baltimore City Police Department has had a transformation with some personnel. So we kind of got rid of some old stuff and got some new stuff. So the new stuff seems to be working really well. And the old stuff is off the pasture. And so we're trying to move forward with those with our new unit and be more proactive. We also have a new state's attorney in Baltimore City, and I've met with the person who is going to be running that program, that unit. And he's super proactive, and he's super just so excited to get our human trafficking unit out of the state attorney's office up and running. They've reversed some policies that were not working too well with us up there. So things are looking really on the up and up. So, I mean, I really expect our unit up there to be one of the leaders in the state for doing cases.
We're going to have a little competition.
Let's go, bring it on. We'll start next Saturday at the Chesapeake Bay.
Okay, if I'm not there, start without me. If you could briefly, because some here may not understand what the Regional Navigator Program is, could you, like in 3 sentences, explain what it is?
Yeah, that's a program that was implemented by legislation a couple years ago that came out of the Safe Harbor legislation. That actually I worked on that when I worked at the governor's office. And then when I left to go to Baltimore City, they kept it going. So each jurisdiction in the state of Maryland is going to have a regional navigator, which encompasses child sex trafficking all the way up to age, and Andrea, correct me if I'm wrong, 24. I think it's 24 is the
Correct.
so anywhere up to age 24 that law enforcement encounters a survivor of trafficking, they must notify the regional navigator. So the regional navigator is the one who's just making sure that there's no gaps in services, nothing falls through the cracks, that everything is streamlined and handled the right way. So I know there's through the governor's office of youth, GoCap. I can't remember their new name. Let's just call it Go. Can we just go back to GoCap? It was just so much easier.
Just don't tell our new governor, but.
Yeah, well, I'm still gonna call it GoCap. I don't care. But anyway, so they got a lot of money, and they were pumping a lot of money into the regional navigator program. So I know up in Baltimore County, it's run by Turnaround. In Baltimore City, it's run by the regional navigators housed at Center for Hope. I'm not really sure.
Prince George's and Montgomery County is run by the University of Maryland Safe Center.
Okay, Safe Center's running both out of both of yours. They're double dipping. How about you, Andrea? Who's your regional navigator?
Turnaround. So they have Baltimore County and Howard.
Oh, they're double dipping too.
Yeah.
Yeah.
Julie, who do you guys have down there in Dorchester County on the Eastern Shore? Mute.
We just got, yeah, thanks. We just got actually a new navigators in the mid shore, which is For All Seasons, and then the lower shore is Life Crisis Center.
Awesome.
And
So
what's the-
I mean, I know, I talked to Heather Amador not too long ago, and so they're supposed to be coming out with a white paper because they got like like almost $1 million that they need to get rid of by June 1st. So yeah, well, just start compiling your list of stuff you want, computers, personnel. I mean, who knows what
Personnel, people.
it all has to be spent by June 30th. So
All right. Outstanding. Well, hopefully, Tom, you can stay because we've got 2 more presenters and then get back to some of the questions that people had to talk so that you can be here for part of our learning from each other. So
Sure.
thank you, Tom. Thank you. Thank you. Next, we have Andrea Nunez from Howard County. We're excited to hear from her about what Howard County is doing. She's from the Office of Human Trafficking Prevention, DCRS. Thank you.
Hi, everyone. I'm going to try to show a couple slides. If it doesn't work, that's fine. I'm sorry. It's not working yet, is it? Let's see.
Not yet.
Yeah, it could be my computer and not being updated. Anyone else really struggle to keep up with the updates and all the, yeah. All right, so I'm gonna.
Well, they
skip
shut
this
us
one.
down if we don't update, so.
Yeah, I'm at home. I use my personal computer. Yeah, and I sympathize with anyone who struggles to stay updated all the time. You have my support. Anyway, so I'll just speak and I will try to keep, just a couple minutes, maybe 10 total. I understand from you, Renee, that's roughly the time we have, a little less. Is it?
Yeah, about 10, yeah.
Cool. Well, it's good to see so many familiar faces and have a chance to talk with some of you who I've not met before. Tell you briefly some of the things we're up to in Howard County. First off, yeah, as I always say, we've benefited from so much partnership and ego-free collaboration and support from people on the screen. So that's a big just benefit we've had and something we're grateful for and would be, very happy to try and pay forward to the extent we can in the future. If any of you want to connect with us about anything at all, I'll put my email in the chat again. Tom, Renee, lots of people in Prince George's County, probably more of you. I already emailed with Ashley after her presentation. So we really love the partnership in Maryland. We try to be good partners ourselves. So thank you all. Anyway, so Howard, I am the Office of Human Trafficking Prevention. I have one awesome person who works with me, Brianna McNamara, in my office, and she and I also support our local task force, which in Howard County, we gave a bigger, longer name called the Howard County Human Trafficking Prevention Coordination Council. So similar to, the task forces you guys probably have in many in your jurisdiction, it's it's appointed by our county executive, so maybe a little different than some of you. It's not as big as Baltimore City. It's more like 20, 30 people max at our full meetings, and it's open all the time to guests. Certainly, we'd welcome you. We can follow up about that. We have some members of the public on it that are appointed, and then we have a lot of the natural stakeholders in and outside of government. One of the big key changes in Howard County lately is that we have transitioned our direct services funding to Turnaround, who many of you know has worked well in Baltimore City, Baltimore County, other kind of surrounding counties as needed probably for many years. So Rachel Sy, Amanda, and all the outstanding direct service experts over there have taken on Howard County. And so they have, that's within the past year or so. So they have some new staff they've hired. Stephanie Gonzalez, for those of you in kind of direct roles, certainly referrals to Turnaround. They do not have a wait list. They have staff capacity. They have funding to spend on transportation, to do screenings and to serve all ages, all genders, and be as low barrier as possible, the way they have been in Baltimore County and City for a long time. So if anyone needs Turnaround, Stephanie Gonzalez is the main staff lead for Howard County Services. She's new, she's really awesome and experienced in sex and labor trafficking service. She comes from the West Coast. So I'd be happy to, in this kind of professional setting, then introduce anyone to Stephanie on a referral, she's happy to give out her direct cell to professionals to grease the wheels for any calls about individual potential cases. So Turnaround is up and running. They have a couple workspaces in Howard. One is in Columbia, one's in Laurel. So they're present, they're, able to, go where needed for a client, but also have the, established space now. So that's a big, wonderful development. A big piece of what I'm doing, this year alongside them is trying to build referrals, get the word out about them, get more people calling. We're focusing, like many of you, like Tom did a while back in Baltimore and Prince George's, on the priority referral partners, making sure everyone knows to call Turnaround, doing trainings, outreach, greasing the wheels for the connection between our public schools. We have, call with DJS soon, Jessica Dickerson, just making sure referrals hopefully come, as freely from the public, but also well-positioned partners. Our hospital, we've, school, hospital, working on mental health providers, anyone working with youth. With Tom Stack's help, we did last year implement fire, basic human trafficking training for all of Howard County Fire and EMS, which is almost several hundred of them, and we got the volunteers to opt in. So I'm not sure, I don't yet have data showing referrals. I think Tom told us in Baltimore a couple of referrals have come in from fire. I'm not aware of any yet, but we have tried to take that, good first steps and be available to follow up on it anytime. We definitely have some good partners in Howard, good relationships. One of my favorite thing about working in Howard is people are willing to, and I hope you all get that where you are, to take a meet, if I email them, they're right back, like random agencies, permitting department, right? I'm not, liquor inspectors. I'm not sure that I've met them in Howard, but I will renew that. So I'm not sure we have the, exact same role in Howard and expecting certain establishments, but all those types of people generally are really open to a conversation about how they may help. So training, we're heavy in that phase this year as Turnaround comes on board, doing lots of, smart, public outreach training, to, anyone who asks, really. Like, I know, Renee, I remember hearing you once say, no group's too small, even if it's a couple people on a weekend, we try to say yes. And either me alone, my office, Howard County Police, really, I commend them for making a lot of time, which I know is scarce for law enforcement and small departments, for presentations to the public, trafficking 101s. They do that really well. And I think even, with their very different law enforcement perspective to turn, from turnaround victim services. I think we give a really nice kind of group messaging on trafficking, how hard it is to spot it, honestly, in the public, and how to, basically who to call, making themselves available for tips, should they come in, and certainly the credible ones they do respond to. So we've done a lot of that. This year will continue in 23. We had a documentary screening. We have, I'm curious to hear from you all after, we've tried to get back to in-person events, like, at our library, a movie screening, meeting, that in government, I think there's definitely interest in getting back to in-person, but I've seen, it's been kind of slow going. I'm not, having massive crowds. I see we're doing a virtual meeting here, and I think that's really useful for a lot of time. So I'm first to admit, I think we're not seeing huge crowds wanting to come out to events in person yet. So we're trying to be, work that in and, have offer digital events, basically. Like I've seen Turnaround, for example, do wonderful Instagram live presentation, that get a whole bunch of viewers, people, right, on their phone somewhere. So I'm trying to, we're trying to be really mindful and thoughtful about that as we kind of choose how we spend our time with limited time, teaching people about trafficking and, promoting Turnaround as who to call if they ever suspect it. Yeah, a person needs assistance, or law enforcement. And I will wrap one of the, those are some of the major things we worked on. One of the other, probably coolest thing we were able to do this year was start a small outreach pilot. I think Renee has heard about this before. We partnered with a worker, migrant worker rights group called Centro de los Derechos del Migrante, CDM. They're Baltimore based, and they have an awesome website for those of you who aren't familiar with them. And we decided to pilot some direct outreach to migrant workers on H-2A and H-2B visas that are present in Howard County, because it was a small little universe and we could wrap our arms around it in Howard. I did the research, found everyone on Department of Labor websites, all with publicly available information. And so basically over, this spring and fall season, when those workers tend to be present in the US for whatever the job is, agricultural or not, CDM was basically able to go have that first in-person conversation, and ideally outside of work, at whatever other public access point they could locate the worker at, whether it's where they were living. We found, we identified good stores where workers come to shop, outside of work, Latino stores, gathering places, and around the workplaces. So we reached about 60 workers that were mostly H-2A, H-2B, all Mexican, from different parts of Mexico, and just that first conversation, and like a rights-based worker-focused way. What do you need? And talk to them, collected data that is useful. But I will share with you all, as some of you have asked about restaurants and places of concern, we did see some big concerns. I wasn't on the trips, but CDM reported to me on all the trips that they took. And for example, the Laurel Racetrack, fairs, agricultural workplaces, different workplaces where those visas can be used by the employer. There were some concerns that we're seeing. And so now hopefully, we did some harmless outreach, and the workers have materials in Spanish with the numbers they can call if, and if not always in a trafficking way, just is anything wrong with your pay? Did they not pay you enough? Any kind of exploitation, civil or certainly criminal, where they can get someone great Spanish speaking on the phone to start, offering them assistance should they need it in the future. So we're going to do that again next year. I'm excited about that because I think that's, one of the best things us civilians can be doing. And I think our law enforcement agree. Law enforcement is limited, that when we want to go talk to workers and, educate them about their rights and just say, what do you need? That's one of the best uses of time. I'll end with an offer to share notes too. Again, I'll put my email in the chat. I was able to go to a conference in LA recently where at least one person from Prince George's was also there, focusing on the illicit massage industry, which always gets a lot of attention in our field. And it's super hard to, do right by, right? To make a difference in. So it was heartening there, like Renee, to hear a lot of people at DOL, prosecutors on the West Coast in LA, where there's been, lots of these similar issues for decades, right? Make very clear recommendations. They said what we should do is just can do this kind of outreach, surge, like have wellness checks to workers wherever they are, wherever they live. We need to compete with what they're getting on the other side from a trafficker, from whatever the employer is. Different people said that. Build your reputation as being helpful, turn around, build your fame, and get, go that last mile with them. Go to wherever they are, in person, digitally, maybe through ads, online communication, through different platforms like WeChat and Live, for example. Those are things we're starting to hear more and more, and we're committed to trying to incorporate into our work here in Howard. I apologize, I may have gone a minute over. Thank you for listening. I'll put my information in the chat. I'd love to connect with any of you anytime.
There we go. Great. Thank you. Thank you so much. Andrea, wonderful, wonderful stuff. Hopefully you can stay so that we can get our last presenter on, and then we can do a little debriefing or answer questions that people have. So last but not least, I know I said that before with Tom, but there was page 2 that or page 4, I'm sorry, that I didn't see. So my brain is dead. Lara Kingston. So Lara Kingston is from Westchester County, New York, Anti-Trafficking Task Force. And so much like everybody's talking about, we are very intentional about reaching out or having conversations and collaboratives with people that are outside of our immediate jurisdiction. And Laura actually was at a meeting with someone from our Vespa, moment of silence, Vespa from our task force. And then Vespa facilitated sort of, this meeting that we had. And so we asked Laura to come and talk to us and tell us a little bit about what's happening in upstate New York and what they're seeing. So thank you, Laura.
Thank you so much, Renee. I so appreciate you all having me here. And in general, just appreciate what you're doing with this collaboration between different groups in the region. So I just want to start by kind of giving a little bit of context about Westchester County. We feel like we have a unique situation, but I think there's a lot of overlap that many different task forces likely experience. So we are a county right north of New York City. It has 6 cities, including Yonkers, which is the 4th most populous city in New York State. And it's a very prime location for human trafficking due to that proximity to New York City. There's a sizable immigrant community. There is a lot of folks without documentation status, so that is an increased vulnerability. And there's a lot of industries in the county that require a multitude of workers of different kinds. It's also a county with a lot of wealth disparity. So we see very low income areas as well as like the wealthiest towns. And with that comes a lot of trafficking, a lot of invisible trafficking. And this organization, we are one of the DOJ funded task forces. And we actually just got funding a couple years ago, but it was launched in 2010 when there was a case where essentially there was a trafficker in a small town in Westchester County, and there were a few different folks who got involved, from service providers to law enforcement, and there was a real need and an understanding that there has to be more communication going on between different folks with different perspectives and entry points to the issue. So they've been working strong for quite some time, essentially coming together, making this network so that anytime there's a case going on, maybe if there's a question about prosecution, if there's a victim or survivor with specific needs, people can access this kind of coalition and have a chance to see, okay, who can help us with this? Who can provide what kind of resources? And we are headed by the organization that I work for, which is the International Organization for Adolescents, as well as the Westchester County DA. And we have a lot of sort of visions and goals that I think are probably similar to a lot of your organizations. Essentially, we want to be holding perpetrators accountable, but also leading everything with survivor preference and survivor needs. So we understand that accountability doesn't always look like someone going to jail. It might look like someone getting the resources they need, making sure that there's back pay for potential wages if it's a labor trafficking case. And we try to come to everything with a very trauma-informed and survivor-centric approach. So like I said, our main goal is kind of building up this collaboration between service providers and law enforcement and government to make sure that everyone's doing our part and having the relevant support we need from different sectors to work on cases and support survivors. So while we do work in New York, primarily in Westchester County, but we also try to build partnerships throughout the state, we're really excited to be learning about what's going on in different task forces and different organizations in the region. We so understand the value and importance of getting support from each other. There's a lot of overlap, like I said, in the different kind of issues we have, the challenges that I think we all see in this field. And so we're really excited to share resources, and I encourage you to reach out to us about questions, and I would like to be reaching out as well. So to give a little bit of specifics about what we've been up to and what our focuses are on, right now, part of our grant deliverable is connecting with youth serving organizations. But we also have been doing a lot of work on the intersection of disability and trafficking and working with the LGBTQ+ community. So this week we had a training with the Loft, which is a great community center for the queer community, basically going over the vulnerabilities that the community faces that can contribute to trafficking. And soon they'll be coming to train us on essentially literacy on pronouns, identities. We want to make sure that both service providers and law enforcement have all the knowledge that they need to really be affirming survivors coming forward. And we know that survivors from the community often have hesitations or understandable nervousness about how they might be received. So we want to do everything we can to make folks understand that while we are collaborating with these big systems that a lot of people do have trauma with, this is a very vetted, mindful group of people who are here to support and affirm. We had a recent training on labor trafficking. We understand that sex trafficking gets a lot of attention, a lot of media coverage, a lot of funding. And, I think there's a huge issue there, part of which is the fact that there's so much talk about it. In addition to education, a lot of folks need sort of like unlearning from some of the representation maybe we've seen on TV or sensationalized stories in the media. But we also wanted to be talking a lot about labor trafficking, which can go so unnoticed. And like I mentioned, in Westchester County, it can be really invisible. There's a lot of folks in the agricultural fields, in domestic help, who are existing, a trafficked life every day, and folks, walk by it, and there aren't necessary indicators that people are conscious of. So that training was in early December, and we had over 400 registrants from all over the New York, as well as some folks from outside the state. And there was a big focus on immigrant organizing groups, Latino community, and really making sure that we are working with activists on the ground. So that means folks who deal with trafficking, but also general exploitation, wage theft, and other issues that can impact people with additional vulnerabilities. So we are at this point also looking to do some training on men and boys. We want to be giving some attention and making sure that folks have additional knowledge on the risk factors and indicators for trafficked men and boys, for male identified people, and also really be acknowledging some of the challenges and some of the stigmas, particularly around sex trafficking that happens to boys and men, some of the reasons why folks might not come forward as victims. So we are kind of looking at all these different intersections and all these different communities and trying to figure out how we can best equip service providers and law enforcement to to serve the community and to be prepared for cases that might come forward. And something that we find really helpful in the task force is there are very close connections and bonds between different members. So actually this past week, we had a case where there were about 30 people being held in a warehouse as a sort of makeshift brothel. These were sex trafficked individuals. And within a couple hours, it was on a weekend, because I think we all know so often things come after 5 p.m. on a work day. So we were able to, through exchanging cell phone numbers, we got DHS and DA and law enforcement, and everyone kind of swept in fairly quickly to move forward the case. So I mean, a lot of you all have been saying this today, but just that importance of collaboration, I think in general in life, but in this field specifically is so essential. And something that I am the task force coordinator, and what I'm really looking forward to learning more about is working with folks coming from different perspectives, working, service providers with all the kind of social worker language and vocabulary, working with law enforcement, working with government, working with FBI, and making sure that we understand, that we're all coming to the same issue with the same goals, and trying to navigate how we move through maybe cultural differences in terms of training and education in these different fields. So I'm really excited to be connected to the Prince George task force, and to be coming to get, hopefully get some more knowledge, get some more wisdom from you all. And I really encourage you to reach out if you have any thoughts on some of the trainings or intersections I've mentioned. These trainings, most of them are open to whoever would like to join. So this one coming up on boys and men, especially, we're really hoping to get people involved. So I will put my information in the chat, and I welcome you all to reach out. And thank you again for hosting me here today.
Outstanding. So Laura, is the boys and men training, is that virtual or that's in person?
Yes, that's a great point. That will be virtual. I really appreciated what was just said about that kind of figuring out the balance of Zoom and in person as we navigate this new world. But this will be on Zoom. So hopefully folks from out of town can be welcome to come, and then we're also trying to figure out what that balance looks like in terms of, accessibility and being inclusive to folks with disabilities who are immunocompromised due to the pandemic, have some concerns, but also understanding that there's a lot of great things that can happen with in-person connections and networking. So we're grappling with it, as I think we all are. And yeah, we would love to see you at our upcoming trainings.
Wonderful. If you can, do you have that information that you can drop in, or do we have to contact you or maybe you could send it to Caitlin and Caitlin can push it out?
Yeah, sure. We are actually still determining a couple of dates. So it's early on, but I would love to share with Caitlin and make sure that information gets
Yes,
out.
because I know, I'm sure there are many of us that would love to attend that, to kind of see.
Wonderful.
Yeah, absolutely. Not only to be supportive, but to learn. So
yeah, absolutely. Thank you.
Thank you so much. Are there any questions for Laura? Or comments? You can unmute if you have anything you want to say, or drop it in the chat. The pregnant pause. Well, we really, really, really appreciate you coming and letting us know what's going on in the Mid-Atlantic region. So we're going to have just a little bit of some questions. I want to get around to throwing those out so we can get some brainstorming answers. But before that, I just wanted to share a couple of things from our task force, just some couple of outreach things that we have done and are working on, and then 2 other things. Thanks, shout out to Jackie Roan. She was able to arrange for us to get into, I don't know how she did it, but we're in all of the motor vehicle administration. If you happen to go there, you'll see on the board one of our, you'll see human trafficking awareness and poster board. So thank you, Jackie Roan. Sorry, guys, but it will be in your jurisdiction too. Sorry, not sorry, right? All right. Jackie, also, see, the Department of Family Services, they are a great partner with us. We developed some memes for churches. So Jackie's idea is as churches are doing their service and between different things, right? These human trafficking things are on the board. So if anybody wants any of this, you can contact us. We actually did a campaign on billboards, bus shelters, and on our county, the bus. So we had a campaign going. We're going to do that again, hopefully soon. We developed, and we've had this for a while, a small little reference guide for law enforcement, signs, basically for patrol and who to contact. We've updated that with the QR code, but we're waiting. The county is doing an update on the internet. And so until that is stabilized, we don't want to get that printed or put the QR code out because it may change. So we're just waiting on that last little bit. We also developed as a task force another little reference, little pamphlet, and it's all also virtual for the community, signs and questions and resources. Thanks to Detective Tony Hill, he arranged for the task force, and Cheryl Banks went for us to go to the Washington Commanders. That we have the football here in Prince George's County, and so she had a table. It was actually during Domestic Violence Month, but she really made some great connections and just talking about that in the intersection, and actually got a couple of people's services just from in the lobby as people are going into the game. Upcoming, I haven't quite figured it out, but we did a training for 2 sororities, national sororities, on human trafficking, and from that, their call to action is to have a day where we go to the various metro stations within the county and pass out awareness literature. And as I stated before, the Office of Human Rights is where the task force sits. And so we are cross-training our investigators who investigate discrimination, allegations of discrimination, and employment is one of those, as is public accommodation. So really looking at human trafficking through the civil lens, and seeing if we can, identify. With that, we actually have had communication, 3 different meetings with labor unions. They have particular interest, and they're on the ground, some of the organizer. And so we actually just had a meeting on, I don't know what day this is, some day this week, Tuesday afternoon, where they had about 12 workers who wanted to talk about what is potentially labor trafficking. So we have signaled to our Prince George's County leadership about perhaps a case that is developing. And last but not least, one of our newest committees on the task force is our data and analytics committee. And we were actually supposed to have a wonderful presentation, but that presenter had a family emergency. But we are developing, and they're all up and running, but a way to collect data from all of our community partners, because we recognize that data collected strictly from law enforcement is really not it's not the complete picture of what labor and sex trafficking is. And so we're building this from a community perspective. And so we're excited about what this may reveal. So stay tuned for that. So, back to just a couple of the questions. The one that Andre had about how to report. So Tom, you started to ask if you're still here, if you're still here, that discussion about how does somebody report, where do they report, et cetera. And I know we all have opinions and tactics and ideas, but please jump in so we can answer that question that Audrey, sorry, had. And Andrea had the question about virtual versus in person. What has everyone seen? So let's tackle the first question.
Are you talking about how to report suspected human trafficking?
I think Andre, yeah, that was her question. Yeah.
Yeah, I mean, obviously, if it depends on if it's like emergency, then, you know, obviously 911, and report it there. If it's something that's, you know, something you suspect, like it's a brothel or something going on in a location, you can contact your local police department and try and find their human trafficking unit or their vice unit. A lot of vice units are actually kind of morphed into human trafficking units. That's what happened in Montgomery County. We started off as a solid vice unit. We were doing prostitution enforcement, and then as awareness came around, human trafficking kind of morphed into, took over. So we became a human trafficking unit, but we were still called the vice unit. And then there's always the National Human Trafficking Hotline. You can always call and report something there, because that eventually funnels down to local law enforcement. But I would reach out to your local law enforcement first. And then if you don't get anything there, you can also reach out to state police, because state, like, you know, Maryland has human trafficking investigators with the state police. They're actually the child recovery unit. So they're very good. Or you have your federal agencies, Homeland Security Investigations, and also FBI.
Yeah, lots of places, and it'll funnel to where it needs to. Yeah. And then Andrea's question about sort of virtual versus in person. What are you guys seeing? What are you doing? How is it working out? Pros, cons, etc.
I'll throw my 2 cents in. In person is way better. I mean, it's just way better. And but virtuals is a necessity. I mean, you got to have, if you can do both, you do both. But then you run into technical issues. I mean, I don't know how many webinars I've been on where you're like, you know, I can't hear you, I'm on mute. You know, it's like, you know, I got bad Wi-Fi. You know, it's like, I was on a presentation, it was like 300 people waiting to hear this guy speak, and he couldn't speak because his Wi-Fi was bad. And then also in person, it's just so much more personable. It's like you see a person. I mean, I do a lot of presentations, and I hate presenting online. I hate speaking into this stupid little white light that's shining in my eye right now. I just rather talk to people, and you can sense your audience. I mean, you know, you don't know if people are sitting there playing, you know, Candy Crush on their phones, or, you know, they can still be doing that in person too. But it's just way more effective, and you get the point across way better in person. So, but in this world we live in, that's what we got. You know, you got to take what you get. But if you can do in person, do in person, like we're doing in person. And Laura, hopefully you come down from New York, you come to the Human Trafficking Professionals Seminar in October. That's in person.
I
And
would
it's in
love
Ocean
that.
City.
Thank you.
It's in Ocean City in October, which is really not a bad place to be. It's right on the beach. But I'd rather do in person. That's just my 2 cents.
Yeah. What do you guys think? Any strong opinions? Danielle, yeah.
Thank you. For what I do, typically the program only sends a trainer to audiences greater than 12 in the past. And coming in during COVID, the great thing was I was able to provide training pretty regularly, back to back, not having downtime for travel time, and a cost savings to the program, and not paying mileage. I love in person. I love real engagement for training folks and engaging folks, and being able to get the one-on-one training where that wouldn't have happened by driving in person. It really is a great cost savings. But sure, I don't love glaring at the white light to make sure that I'm looking at the audience and not elsewhere. But you know, definitely love in person and that kind of connection. But for being able to train as many for our program, it really has been, you know, quite a boon. Thank you.
Yeah, you know, I'm sorry, was somebody speaking? Yeah, I hear exactly what Tom is saying. In person, right? Nothing beats that human connection, but I do find lots of advantages online. I think that we're finding we have more people consistently online because we're not competing with whatever else they have. We do, and at the Office of Human Rights, we have robust outreach and engagement on lots of different subjects that are civil and human rights, education and enforcement type things. And we have a steady group, and it's, you know, on YouTube, and it's live streamed and on demand later. So we get lots of hits. So the message is getting out there. And it allows for people not, rushing from Washington, DC, if, they're commuting from their federal government job, trying to get the kids fed or whatever, right? They wouldn't be able to come to our in-person because it would just be too much. So, the pros and cons right now, I mean, the pandemic isn't over yet. I'm sorry to be the bearer of bad news. It's not over yet. So the virtual space is working for us. We'll reevaluate once things settle down. I imagine we're committed to always having sort of a hybrid. So we will have to work out those technical things. We purchased some things at the end of last year to help once we are able to do in person and streaming at the same time, but it'll be a challenge. But I think that this is not going away ever now that we have started doing virtual. That's just my opinion, but glad to hear from others.
Yeah, thanks for that, Renee. I hear you totally on that. That's what we're seeing on our, like your task force, right? Are you guys still meeting virtually? Ours is, we try to do a survey, what do you guys want? What's everyone comfortable with? What's everybody, busyness tolerance, commuting tolerance? Yeah, and there was a clear preference for virtual, even though I agree totally with Tom that in person's better, I think. For a really awesome human collaborative, productive task force, they just for virtual now. So I hate to overrule that preference. And then public engagement, it's, a little different. Like virtual events, I think sometimes can be really useful versus the classic, like come to a place on a weeknight, get babysitting or, get your life in order. Yeah, that harder ask to come out to a, a free event. At least in Howard, we're a smaller place. We're not a, big city. So.
Yeah,
our Baltimore City Human Trafficking Collaborative is still meeting virtual, and we probably will for some point in time. Our law enforcement subcommittee meets in person, and at our last meeting, I mean, the meeting was over at 2:00, and at 3:00 there were still people standing around talking. So especially in that law enforcement world, and it's that networking is so important, and it's just you can't network online. You can send someone a message in chat, hey, how are you? But I mean, it's completely different. So it works for us, for our law enforcement guys to meet in person, to network like that, but we're still virtual.
Yeah, do you remember when at least for the county, they gave us, I think it was called business Skype, right? And they were pushing like, just, instead of driving to that meeting, use this. And my reaction was, well, that's ridiculous. Like, why would I not go? Why would I sit at my desk and, look at a screen, right? And now when they ask us to come in person, I'm like, well, that's ridiculous. Why would I drive, right? So it's just funny how, culturally we've all changed. And so anyway, yeah. So Andrea dropped in, perfect for resources and ways to respond there. So speaking of networking, connecting, we're going to leave the room open. First of all, I want to thank everybody for coming. I know it was a time commitment, not as much if you had to drive, but still a time commitment yesterday and today. And I think that we learned a lot from each other. I know I picked up a lot of ideas and things that we can enhance what we're doing. And I think the most important thing is for us all to feel supported and to feel like we can reach out. So I'm hoping that part of this has built some of those connections. I want to especially thank Caitlin Moeller from the Office of Human Rights for helping plan this. I want to especially thank Jackie Roan from the Prince George's County Department of Family Services for helping to plan this. I want to thank Jatna Gomez from the University of Maryland Safe Center for helping to plan this, and Vespa Glenn, formerly from the Office of Human Rights, who helped plan this. And we all got together, spent many hours. Thank you for each of you that accepted our invitation to come and present and speak and tell us what's happening. Thank you for those who came to listen and to ask questions and to learn. And so thank you. Stay tuned. We used to do this in person before COVID. It costs more money to do it that way. This was certainly a lot more affordable. And if you're anything like us, we actually do not have a line item for human trafficking in my office. We have no money for human trafficking. So everything we do is, you know, begging or borrowing from another, you know, line item, et cetera. So stay tuned. We'd like to do this again next year. Maybe it'll be hybrid, maybe virtually. We know from history that pandemics are 5 years from beginning to end. We know this. So we're almost there. We probably have another 18 months because it probably started November of 2018. I'm sorry, 2019, right? So we're almost there. So we'll assess to see where we are next year, whether, you know, we do this in person or hybrid, et cetera. So thank you, thank you. We're going to keep, again, the room open for anybody that wants to do any networking. Caitlin, I'm going to turn this over to you to tell us how that's done or what you envision.
Yep, so I'm just gonna stop recording and then